Next is Pediatric Emergency, and Matt Thacker is the program head for that, so I'll let him talk about that.
I think we might have lost Matt. Carrie, do you want to?
He just messaged me. Can you hear me okay?
Yes, yeah, if you want to take content, thank you.
His computer died. Okay, so hi everybody. I'm going to step in for Matt here. My name is Carrie Mahar, and I am the program head of the emergency nursing program as well as the pediatric emergency nursing program. So I'll speak on behalf of Matt for the pediatric program. So this program, again, very similar to what Tara said, is for individuals who has a passion for working with the pediatric population. So this program is if you are a current practicing registered nurse wanting to advance the pediatric emergency nursing, if you are a current practicing registered nurse and you're wanting to advance your knowledge and experience as a pediatric emergency nurse, this program is for you. Also, for those that are want to complete their specialty bachelor's of science in nursing in specialty nursing as well. Again, working with children and their families, it's a collaboration and a partnership caring for the family as a whole, and have a strong interpersonal and creative thinking skills, especially when communicating with young people. This specialty nursing program does not require relative work experience as well. So next slide there, Julie. This is a beautiful picture of some students, recent students in our program who had some experience and time in our specialty nursing lab here. So the program overview, just pediatric emergency nursing is really dedicated to the health and care of young people, ranging from very small babies, premature babies, all the way to our older population in the teenage world. Children as patients have unique healthcare needs that require specialized knowledge and expertise in their growth, illness, and injury. Next slide there for me. Okay. Really important as a pediatric emergency nurse to be strong and in your communication skills. Also great communicating with the younger population and building trusting and caring relationships with the patient as well as their families. The emerge department can be at times quite intense and dynamic and fast paced, and often a scary place for young patients as well as family members. So often you're going beyond just caring for the patient in front of you. You're also caring for the family and supporting the feelings of maybe of feeling overwhelmed or anxious, and being able to support the family through that experience as well. Next slide, Julie, thank you. So this program is really truly one of a kind in Canada. We educate nurses here in BC, across Canada as well as internationally, which is really, really exciting. Our program gives you the skills that employers seek to work in the pediatric emergency nursing world. So we do deliver it part-time, similar to the other programs that and the other program hands that have shared with you. It can be completed on average over 2.5 years. We offer it distance as well, and that online learning experience provides the flexibility to kind of learn at your own pace and learn in your own environment. And there is one pediatric experience that is completed in a pediatric practice area. So here in BC, you would be in a clinical experience either at one of our lower mainland hospitals. Surrey Emerge has a wonderful pediatric emerge department there, with another part happening at Children's Hospital as well. So next slide is, oh great, yes, the student testimonial for one of the pediatric emerge nurses.
So thanks, Kyle, for coming out today. I know it's super busy in today's world, but I appreciate you taking a couple minutes here just to speak to the program. So if you'd like to maybe just say hi and introduce yourself.
Perfect. Hi, my name's Kyle, and I previously worked in the emergency department at Children's Hospital. And currently I am a coordinator with the Vancouver pediatric team and a clinic nurse with Insight.
Great, yeah. Well, thanks for coming, Kyle. Thanks for sharing all of your insight. So, you know, thinking back, you took our program a couple of years ago now. So just thinking back to that time when you joined, why did you decide to, you know, take the leap and join the program, and what did you envision for yourself?
Yeah, the the emergency department is one of those places where you get to be the jack of all trades, master of none. And it's a controlled chaos, and it's a perfect mix for getting a lot of things accomplished, but it doesn't really give you that opportunity to take a deep dive and to really understand and hone certain skills. So what I was really looking forward to with the program was the opportunity to consolidate my knowledge and my practice, and to get into that simulation world and prepare for those one in a million cases that PEDS is known for.
Yeah, I'm so glad you spoke to that, because that's a huge advantage of taking the time in these programs, right? Is to the ability to be a student again, and to be vulnerable, and to learn all these things that we may not, especially in emergency, you know, have the time to actually understand some of the things that we're seeing, because it's quite chaotic. So I appreciate you saying that. That's amazing. Yeah. So reflecting on your time at BCIT, what did you like about the program? What did you value in it? You know, reflecting on those 3 months.
Reflecting back on it, I really valued my time with the instructors. I felt coming into this experience, in some ways I felt like a nursing student all over again, but then working with my instructors and and the clinical instructors, it was as if we were peers and we were all learning together, which was a great environment to be in. The other piece that I really valued was the simulation, the amount of simulation practice, the equipment that was accessible to us. I felt that I could directly see from before I started the program to after my confidence in the critical care setting, and just being able to navigate what should be happening, how to advocate for clients, and just the communication level that should be there.
Yeah, I couldn't agree more. The team we have in our little program is quite amazing, and you know, not only the experience that our instructors have, but also I think, you know, the networking as well. You know, pediatric emergency can sometimes be a little bit of its own little world. So you know, that networking, you know, learning from people, you know, so experienced and so knowledgeable, it definitely puts a perspective on everything. And I mean, branching off of that as well as that simulation staff that we have as well, and the experiences the work that they put into, you know, for us as faculty and for you guys as students is quite amazing. And that's great. Well, thanks, Kyle. So the last little bit I would love you to speak to is, you know, again, reflecting back, you know, before you're entering the program and as you were moving through it, is where did you envision yourself, you know, where did you envision yourself going with nursing, and where did you think it was going to take you?
Yeah. My big plan was either education or leadership. And one of the other pieces that allured me to the program was the frameworks and the processes that would help with teaching and supporting new staff and preceptors and in the emergency department. And yeah, just kind of looking at different master's programs for leadership and policy type things.
Great, yeah, and that's why I was really excited to have you come and speak, because, you know, now working in a pediatric public health lens, you know, it just goes to show that the skills you learn, you know, in a pediatric emergency program can be, you know, extrapolated and threaded through any sort of either emergency or pediatric care that you kind of venture off into, and so that's amazing. Great.
Yeah.
Well, thanks, Kyle. Yeah, I appreciate you coming, and I appreciate you taking the time out, and we'll see you around.
Sounds good. Thank you very much.
Well, I'm back on for, I guess, the most important part is to introduce Carly, but there's all my information there, you guys. Sorry about the technical difficulties. So my own personal contact info, Maya, program assistant, and you'll meet Carrie Muir a little bit later, and you can contact her as well for any information about the PEDS ED.